All right, perfect. Hello, everyone, and thank you for joining this webinar. My name is Paige Knappenberger. I'm the Director of the Environment and Health Program at Physicians for Social Responsibility, and I will be moderating our panel today on the health and equity impacts of data centers. Before we get started, I want to let everyone know that we are recording the webinar today, and we'll share a link to the recording and an email to all registrants. Physicians for Social Responsibility is really excited to be co-hosting this four-part webinar series on data centers with our friends at the Medical Society Consortium on Climate Change and Health, the Alliance of Nurses for Healthy Environments, the American Public Health Association, and Healthy Climate Wisconsin. We are so thrilled to have had more than 900 people register for this webinar. Thank you all for coming and for your interest. Physicians for Social Responsibility, along with our co-hosts, have been paying close attention to the national conversation unfolding around data centers, and many of our chapters and members are fighting dirty hyperscale data centers in their communities. As leaders in public health and climate action, we have very real concerns about the health harms that are arising from data center development, energy, and water use. Just today, the New York Times reported that nationwide, at least 82 gas-burning power plants are being built or have been proposed to power data centers. This represents a major step backwards for the climate and air quality. But community concerns about data centers are much broader than climate change and energy, which is why we are here today. On today's webinar, we will hear from three incredible panelists that are going to speak to the very real and often very inequitable health impacts people living near hyperscale data centers are experiencing. After we hear from each of our three speakers, Dr. Natasha DeJarnett, Dr. Francesca Dominci, and Dr. Micah Nishigaki, we will have at least 20 minutes for a Q&A with the audience. If you have questions, please use the Q&A button at the bottom of the Zoom interface to submit your question. First up, it's my pleasure to introduce Dr. Natasha DeJarnett. Dr. Natasha DeJarnett is an assistant professor in the Christina Lee Brown Environment Institute at the University of Louisville Division of Environmental Medicine, researching the health impacts of extreme heat exposure and environmental health disparities. She is also a professorial lecturer in environmental and occupational health at the George Washington University Milken Institute School of Public Health. Most recently, Dr. DeJarnett was the Deputy Director for Environmental Justice Data and Evaluation at the White House Council on Environmental Quality. Dr. DeJarnett has been a leader in environmental health research for 20 years. In addition, she champions environmental health and justice through her leadership in multiple national and local nonprofit boards, including serving as the president-elect of the Physicians for Social Responsibility National Board and chair-elect of the Environment Section of the American Public Health Association. And now over to you, Natasha.
Fantastic. Thank you so much for that kind introduction. Bear with me just a moment as I set up to share my slides. Okay, thank you so much. Thank you, Paige, for the generous invitation. Thank you, Kate Robb at the American Public Health Association. I am absolutely honored to be here alongside these esteemed presenters. So just much gratitude to Physicians for Social Responsibility, the American Public Health Association, the Medical Society Consortium on Climate and Health, the Alliance of Nurses for Healthy Environments, Healthy Climate Wisconsin. Thank you all for your leadership. Thank you for spearheading this really important series. This is such a timely topic, and I firmly believe that health should be at the center of data center dialogue. And I believe that this series allows great space for that. So thank you. So just to orient us as we dive into this all-important conversation, I want to make sure that we're on the same page of what we're talking about. What is a data center? I here am being specific to hyperscale data centers, these massive data centers, also called AI data centers. They are large, massive facilities that handle huge data and computing tasks. They have thousands of servers within them, perhaps up to 5,000 or more servers, and they take up quite a bit of space. At least 10,000 square feet or more of space. And they use a large amount of power, about 100 megawatts of power or more. For reference, 100 megawatts of power is the amount that a mid-sized city uses, a city with 70 to 100,000 homes. So um, I want to also frame this that we have long had data centers in our cities and even in our workplaces. But these hyperscale or AI data centers have been in the news because of the massive amounts of energy, water, noise, and the resulting health burdens that they can impose on our communities. So I speak often on the health threats of climate change, and this slide summarizes some of those ways that climate change can impact health. I highlight air quality, heat, and drought as they're closely related to the burdens that are also posed by data centers. I find it impossible to ignore these connections. And I also must note that while we're all at risk to the health threats of climate change, there are certain populations that bear a higher burden, and climate change actually acts as a threat multiplier for them. And that can include children, older adults, communities of color, low-income communities. But while climate change can act as a threat multiplier for these populations, data centers can further add to these burdens. And I just want us to kick things off with that framing. So here in Kentucky, specifically University of Louisville in Louisville, Kentucky, members of our research team have been invited to participate in community meetings as data center proposals have come in counties throughout the state. Namely, I'll focus this conversation on Oldham County, which is a suburb to Louisville. Louisville is the largest population center in the state of Kentucky. And then, of course, Louisville, which is Jefferson County. We've also been in communication with folks in Mason County, and I'll share some of the highlights of what we learned from these different counties. So as we've been invited into these communities where data centers have been proposed, it's been a bi-directional transfer of knowledge. We've learned from the communities what is driving their concerns about this based on what they ask questions around. I will say that in the community that was lower income that we spoke, where we spoke to residents, utility costs was the first question that came into the conversation, that they were concerned about the potential for increased cost of utilities in their communities. Property values were a conversation that came up in the more affluent area where we had been invited to share on these health impacts of data centers. They were specifically concerned of projections that their property levels could be cut in half. Children were a source of questions across most communities, where there were concerns of, are there schools near where this is being planned? And ultimately, how will this affect children? And jobs is another factor that came into these conversations, where communities in some cases said we need jobs and we need investments, connecting to positives that they may have heard through government leaders and through the media regarding data centers. Ultimately, what often came up in the conversations, regardless of whether the area was more affluent, whether the area was less affluent, location, location, location. Why would this be here? Why should this be here? What does this location, how does that impact me, my family, and my ability to do my job? So these were those questions and points that seemed to be repeated throughout the conversation and stood out to members of our research team. I've pointed out some of the things that communities have raised. Here summarizes some of the considerations that researchers raise when it comes to data centers and health. Data centers use a massive amount of energy. This greatly increases the amount of energy that our communities use. And thereby, this is connected to air pollution, depending on the source of energy, the source that is powering the energy that reaches these data centers, which is often fossil fuel related, and that we have long known has deep connections to heart disease and lung complications, diabetes, as well as lower life expectancy. These data centers also use a significant amount of water. They use a significant amount of water in particular for cooling. And this consumption of water can exacerbate local water insecurity, increasing the risk of waterborne diseases, dehydration, and even poor hygiene in affected communities. Um, it also can contribute to drought conditions or maybe exacerbate those in communities that have been experiencing drought. And drought is known to exacerbate chronic kidney disease, hypertension, and diabetes. There's also noise pollution that results from being in close proximity to data centers. There is persistent noise in a data center. These are servers that are constantly running around the clock. And there's cooling equipment that is needed. So the cooling equipment, the constant running of these servers, along with the backup generators, they also contribute noise, especially to nearby communities. These data centers run 24 by 7. The hyperscale, the large data centers run 24 by 7. And so the generators that are on site, which are often diesel, not necessarily exclusive to that, generate quite a bit of noise for the local communities. So this persistent noise can affect data center staff. There are videos inside data centers where people are wearing hearing protection, but that persistent noise can also be felt by nearby communities. It can be felt by local wildlife, and this can prompt concerns that we've heard across the nation for a push for noise mitigation strategies. Noise we know is associated with our mental health. It can impact our sleep as well. And this can all impact our productivity. Similarly, light pollution. Data centers can be surrounded by many lights, and this can affect sleep in the nearby communities. It can also affect biodiversity, and that can in turn affect human health as well. There's also heat that is generated. As I said, these centers are home to numerous servers. And if you've ever had your laptop on your lap and felt it heat up, just imagine that times so much more. There are recent reports that data centers can contribute to urban heat island effect or further exacerbate those. And heat islands are associated with heat-related illness as well as heart and lung disease exacerbations. Ultimately, when we're talking about the location of these data centers, we should be very considerate of the health implications that the community is already facing, and how this adds to that. So the cumulative health impacts of data center development is certainly a major concern to health researchers as well. Ultimately, location, as I said, data centers are subject to environmental justice concerns as a part of permitting, whether they are located in urban or rural areas. And they do tend to be built in lower income areas where property values may be lower. So the location of these data centers is also quite important in informing and understanding the potential health impacts that are related to them. So I just want to give you an example in Louisville, Kentucky. What I'm sharing with you are 3 places where we have been invited to share. I'm going to put the spotlight on Louisville, which is Jefferson County. So what you see on the screens are maps of Jefferson County. I share this because it's really important that we carefully consider the location of data centers. So the maps on the screen, they show Jefferson County, and you can see the higher burden of PM 2.5, toxic releases to air, and proximity to hazardous waste sites are in the 80th to 100th percentile in the western portion of Jefferson County. And then if we look at some of these health outcomes, which are shown below, we see that life expectancy is lower, and it is reported that there's a 12 to 15-year difference in life expectancy comparing East and West Louisville. These images demonstrate that along with heart disease and asthma across Louisville. And then lastly, it's important that we also consider the demographics of the area. The amount of the population of color as well as low income populations are more concentrated in Western Jefferson County. Now, what I didn't explain to you is the black outline that's on the screen, and that outlines a heavy industrial area within Jefferson County, and that is proximate to the location where the data center is slated for Jefferson County. So just for comparison, we were invited into a very affluent community that is Oldham County to share. And you can see that this area has no low income or disadvantaged tracts. By comparison, there's also Meade County where a data center was proposed. Ultimately, a data center is being built in Jefferson County, which is Louisville, Kentucky. The area was already zoned for industry. It has a slightly higher low-income population compared to the others, as well as other socio-demographic factors. Health outcomes, there's some indicators that health outcomes may be worse in Jefferson County by comparison, and it's more disadvantaged. And if you look in this industrial center, it's 100% disadvantaged as identified by this darker shading shown in these maps. I will just note that the data in the maps that are shown here are from the Climate and Economic Justice Screening Tool. This is the flagship environmental justice screening tool that was created under the Biden-Harris administration, and it highlights disadvantaged communities and adds further to the understanding of environmental justice in where data centers may be proposed. And I'll note that the previous maps that I shared were from EJ Screen, which was the flagship environmental justice tool of the US EPA. Both of those are available through the website shown on the screen, hosted by the Public Environmental Data Partners. So just to bring things together, sorry, I've jumped ahead. Okay, just to bring things together, in terms of potential safeguards that can protect health and advance equity, it's vital that the community's voice is a part of decision-making, regardless of the zoning of certain areas, that community benefits agreements incorporate health, that the community is meaningfully involved throughout the process. I will note that there are air quality and water usage factors that can minimize burden, but these technologies need to be continuously updated to be able to do this. The public is requesting transparency, and this has been challenging through I've lost the word, but through those practices within industry that are kept tight when it comes to being competitive within an industry. There's a whole word for that. Forgive me for that lapse there. However, there are things like non-disclosure agreements that make it difficult for the community to understand what their potential exposures are and be able to protect themselves. Ultimately, we recommend health impact assessments, that these accompany data center proposals so that we can understand that where these are built, that they don't pose additional harm to the health of the community that may be nearby, and that they can be built in a way that can consider sensitive populations, health status, and the strategic location. I will just note an additional way to stay involved in the conversation on data centers. You're welcome to scan the QR code on the screen or visit the link at the bottom. We've got a number of webinars that have been recorded where you can continue to engage in this health conversation. So proud of the work that these partners today are doing: Physicians for Social Responsibility, American Public Health Association, Alliance of Nurses for Healthy Environments, as well as the Medical Society Consortium on Climate and Health. And I'm happy to return for questions after we hear from our remaining speakers. Thank you so much for your time today.
Thank you so much, Natasha. One moment. I really appreciate your perspective. Thank you for sharing with all of us. Next up, we will be hearing from Professor Francesca Dominci. Dr. Dominci is the Clarence James Gamble Professor of Biostatistics, Population, and Data Science at Harvard T.H. Chan School of Public Health and Director of the Harvard Data Science Initiative. Dr. Dominci is also the founder and lead principal investigator for the National Studies on Air Pollution and Health Group, and co-founding PI and leader for the BUSPHHSPH Climate Change and Health Research Coordinating Center. Dr. Dominici's research focuses on machine learning, artificial intelligence, causal interference, and data science to impact climate and environmental policy. Her studies have directly impacted air quality policy in the U.S. Over to you, Dr. Dominici.
Thank you.
There we go. Perfect.
Thank you. Thank you for inviting me and for the opportunity. So I will mostly focus on where the gaps of research are and what our research has been so far and what we have found. So I think that it's important to keep in mind that there are still a lot of gaps in the literature about the potential negative impact of data centers on human health. I think that, and that is mostly because this is a rapidly evolving industry and there is, facility level inventory. It's hard to have. Often water consumption is reported as in, total numbers on news report. Research is often disconnected by decision making. So there are still a lot of gaps and a lot of work that we need to do. I wanted to mention that there was a question actually in the chat that there is actually progress toward creating a national level and validated inventory on data centers. And by the way, that was the same data source that was reported in the New York Times this morning. There is this site and this company called CleanView. And to get a sense of how fastly growing is this industry, so I'm just showing data from CleanView. And so you see on the left there are over 1,200 facilities that are already operational. And then you see on the right the one that are planned or under construction, and we are seeing that there is already a six-fold increase into energy demand from these data centers. So CleanView, to my knowledge, is one. I mean, I'm sure there are others, but it's a company that really tried to create a national inventory of both the data centers that exist, the facility and their characteristics, and the one they are planned. And these are also the same data that we in my lab are using to do our research. So we have done, this is the research that we have done so far that is under peer reviewed and hopefully is going to be published soon. And I want to just talk about that for a moment. So one is we have done a rigorous study to look at the carbon emission of the US hyperscaler data centers, the one that are already operating. And actually, this is already almost a year old. So you could think for a moment that these estimates are conservative. And then we're also done a careful analysis, and I'm going to tell you more about the methodology, the result, about the water consumption of these hyperscaler. So also doing research on this topic, it's not easy to provide scientifically rigorous information is something that requires multiple steps. And again, I'm not going to be able to go into the detail of the pipeline, but I just want to give you a sense of how much work there is behind this. So in terms of quantifying the CO2 emission, basically what we have to do is to identify the operating data centers, where they are in the United States, how much energy they need. Then we need to figure out which power plants are providing the electricity to this data center, what type of power plants there are, whether are coal-fired power plants or whether there are natural gas power plants, and then trying to quantify, using a rigorous methodology, the CO2 emission that each of these operational data center contribute. One thing to keep in mind, if you look at the map on the bottom, you see there are a lot of orange and red dots. What that identified are the power plants they're providing electricity to these data centers. And the reason why all of these dots are either orange or red is because a full mix of this power plant is mostly natural gas or coal-fired power plants. So one thing to keep in mind that not only we have this data center that require enormous amount of electricity, but the electricity is provided by fossil fuel combustion, which we know has a high impact on levels of air pollution. Similar work we're doing, and also really going into what is the most rigorous way, is also to quantify the water consumption of these data centers. And the other important thing that we have been doing is also to disentangle what we call scope 1 and scope 2 water consumption. Scope 1 is the water consumption of each data centers that is used at the data center to cool the data centers. But then that's not the only piece of water consumption. There is also a second piece where is the cooling of the power grid, of the electrical power that is required to provide electricity of these data centers. So we are doing research to identify not only the scope 1 and scope 2 water consumption of each data centers, but also which of the two is more important and how can we act on it to basically minimize the water consumption. Clearly, you don't want it to build a data center in areas that are already affected by water scarcity, or a data center that requires a lot of electricity where the balancing authority are providing electricity in areas that there is water scarcity. So one very important piece in the water consumption is really that the cooling water are actually smaller. So the amount of water consumption that is required to cool an hyperscaler data center is clearly very important, but is actually less big than the electricity part, that the one of the water consumption that is required for the electricity. And the geographical risk of the scope 1 and scope 2 are actually pretty different. So I'm just going to give you some numbers, and then I'm going to put them in context. So I think that in terms of electricity, this is a conservative estimate. So we're talking about that the operating hyperscaler are already into the around 2% of the US total consumption. There is a pretty massive amount of CO2 emission. I'm going to tell you more about that. 75% of the water consumption is electricity related. It's not actually due to the cooling of data centers. There are 4 states are mostly affected: Virginia, Oregon, Ohio. They will account for, and Iowa, they account for over half of all of the attributable emission. And the 3 power grid are the one that are mostly experiencing the largest consumption. So let me give you some numbers to put in context, right? So I think that in terms of carbon, in terms of CO2 emission, I think that the operating, remember, only the operating one, not the plan, are basically at a similar scale. They have a CO2 emission that is a similar scale of all of the annual US cement process emission. They correspond almost to the emission of 12 coal-fired power plants. Remember that the goal is to phase down all of the coal-fired power plants. We are thinking about it around the typical gasoline passenger vehicle driven for 1 year, corresponding to 9.8 million cars. In terms of water consumption, we are talking about approximately 79 billion gallons per year, or 217 million gallons per day. We have over 2.6 million people that are, so basically the water consumption of this hyperscaler correspond to the water use of 2.6 million American. And clearly geographically, geography matter, which really some of the some of geographic region are more affected than other. And we're going to get to the environmental justice in a moment. And again, 75% of the water consumption is electricity related. Now, in terms of the health impact, one thing that we have been starting to do, and the goal is to scale, and this is again, everything I'm talking, it's going to under peer review, is to quantify the excess number of adverse health outcome and excess number of healthcare costs that is directly attributable to the excess PM 2.5 that is attributable to a particular data centers. So we consider these proposed 3,500 MW gas plant in Pennsylvania County. Clearly, there are many, many more. So we're going to scale the analysis. So you see on the red dot where this gas power plant is has been proposed. We were able to atmospheric chemistry model and a lot of data science to estimate how much more PM 2.5 air pollution in the air was directly attributable. And so you see that the area in purple are the one that have the largest increase in PM 2.5. And again, this is the extra PM 2.5 that is directly attributable to this gas plant. And then we were able to basically to identify not only the area that are breathing more pollution because of this gas plant, but also the healthcare cost. And so we are basically quantifying in terms of estimated damage around the $31 to $65 million due only to this gas plant. There will be between 2 and 4 deaths per year. And then, of course, if we start to project by 2040, clearly this cost increase. In terms of environmental justice, you have to think that in this area, just for this area, we have a 27% of the Black population that is exposed to extra PM 2.5, so it's much higher than the national average, both for the national average of the Black population, also for the average in Virginia. And so the people that are breathing more pollution tends to be a larger percentage of color, tends to be older, and tends to have higher poverty rate, tends to have lower median household income, and tends to have a lower median property value compared to the average for Virginia and compared to the national average. Now, as my colleague pointed out, there are many, many, many issues that need to be considered. So not only the increase in air pollution, the potential of power outages, the water scarcity, the water pollution, the noise pollution, the light pollution, and each of these potential increase in exposure could have a different impact on both short-term and long-term impact. Many of these exposure and health outcome have not been extensively studied yet. And so that's why our goal is to provide actually a platform that can quantify all of them in a very, I would say, both for community and for developers. So I'm just going to conclude my talk. I'm going to show you a few-second video that show you what we are building to quantify all of this impact. Thank you. I'll leave it to you, Paige.
All right, great. Thank you so much. I'm actually going to post the video in the chat, if that's all right, Dr. Dominici, just because we're a little short on time, and that way everybody can watch the video at their own pace. So everybody stay tuned. I'm putting a YouTube link in the chat for you all to see. Thank you so much. Before I do that, well, actually, I'll do that, and then I'm going to introduce our next speaker. All right, everybody should see that now. And yep, thank you again, Dr. Dominici. That was really insightful. Last but not least, we will hear from Dr. Micah Nishigaki before we open the Q&A portion of the webinar. Dr. Nishigaki is a board-certified family medicine physician. She graduated from and completed her family medicine residency at the University of Texas Southwestern Medical Center in Dallas, Texas, and currently practices in Texas. Early on in her medical career, Dr. Nishigaki noticed the limitations of adequate quick care for her patients due to the unjust foundations established in society. She was also increasingly cognizant of the climate's impact on patient health, leading her to complete the Climate and Health Equity Fellowship, or CHEF Fellowship. She is passionate about planetary health and fighting for a more sustainable and environmentally safe future, and hopes to help her patients and communities beyond the hospital walls. All right, Dr. Nishigaki, over to you.
Alrighty, can everyone hear me? Perfect. All right. Thank you guys so much for this opportunity. All right. And thank you for all the organizations hosting this series. So it is a very important topic. And thankfully, a lot of my colleagues have already gone through a lot of the health implications. So I can give a few more highlights, especially as I've seen a lot of these impacts, unfortunately, in the hospital. I think everyone else has seen it, not just in the clinics or in the hospital, but probably with their family members and communities as well. And so data centers have health implications, some direct, some indirect, but all of them are very concerning. And we've been hearing more about this in the news. And so I think for us, in terms of medical professionals and just professionals in general, why should we care in the first place, right? When we see that AI is being integrated into all of our workflows and decreasing administrative burdens and burnout, we also need to think about the costs of these AI usage, right? Like, especially for folks who have promised an oath to do no harm. With this use, how much harm are we actually doing to these communities as well? And so, of course, caveat is this isn't just a data center specific issue, but because of the rapid proliferation of these data centers, I think it is important to have this discussion so that way we can elevate the voices of these communities who are already burdened by data centers, and then B, also give those voices a chance to then help with policy making or a reason to make data centers more sustainable or not being built at all. But the Pandora's box has already been opened. So for with air pollution, and so this slide is just to really highlight, I'm so sorry, I'm going to increase this here. So this is just to really highlight all the organ systems are included, right? Like we have the emissions from air pollutants such as particulate matter 2.5, sulfur dioxide, nitrogen dioxide. They've all been linked to adverse health outcomes, premature death, cognitive decline, reduced fertility, lung diseases. So we will see this regardless of what specialty you are, what clinic or medical setting you work at. This will all impact us and our patients as well. And there was a 2024 study from Caltech that actually highlighted AI's contribution to air pollution and its hidden toll on public health costs, and found that these data centers can lead to 1,300 premature asthma-related deaths and an additional 60,000 cases of asthma annually, just to put some numbers in. I don't know about you guys, I've been seeing a lot of asthma cases in my hospital, and I even have patients starting to go like, there's something going on. It's the environment that's impacting me as well. And so even speaking about the environment, right, with air pollution, we do see that this can actually blanket our planet with heat, which then begets more global warming, which then impacts extreme weather events too. And so I don't want to also negate the voices of our climate refugees who are displaced from these extreme weather events, from the hurricanes, for example, or even the recent wildfires that happened in Washington as well. A lot of people are displaced, which then further begets health implications as well. And so this is all just to highlight and say that while this is second, third, fourth order, this all can impact our environment and then therefore our health as well. Regarding energy use, as Dr. DeJarnett mentioned, there have been recent studies. These headlines are from two separate studies that mentioned how data centers are so hot, you can feel them even if you're miles away from them. And this can even impact temperatures up to like 2.2 centigrade, which is about like 3.64 degrees Fahrenheit increase just from these data centers. And so 95 degrees versus 99, 100 degrees, that's too hot regardless, but then we're seeing more impacts of that, right? But from the health side as well, when we see Heat is related to links of heat strokes, kidney diseases. This even has impact on our medications, right? So this can cause further dehydration, hyperthermia. If these drugs can accumulate in our bodies, they can cause toxicity and side effects as well. Diabetic ketoacidosis, all contributing to healthcare costs and harm to our patients as well. And like I said, I've had patients telling me I can feel the environment, I can feel the heat is doing something. And so all of this is again to say we need to figure out ways to mitigate what is going on. Now, with water impacts, again, we see just a lot of water usage, right? Like it's always hard to it's sometimes hard to quantify how much water is being used, but there are some data centers that can use like up to 5 million gallons of water daily for just their uses, and a lot of it is mainly used for cooling. Unfortunately, a lot of this water is potable or drinking water, and then linked to a lot of the municipal local water supplies as well, which then can lead to water scarcity as well, and then waterborne illnesses. And a lot of these data centers are already built on drought-prone areas as well. If you guys want to, I can show a map later of that too. In addition, there's concerns of water contamination, right? So these data centers use chemical additives to prevent corrosion, scaling, growth of algae or something. But if these waters are treated and say that they leach into the groundwater, then we're facing, for example, the forever chemicals, right? Which have their own health harms. They're endocrine disruptors, so they can interrupt the immune system, sperm quality, fertility, and I should mention, there is no safe level of PFAS, so we should not let any be in our waters or anywhere if we can help it as well. By the way, sorry, I forgot to mention, all of these are headlines from different articles, just to say again, like these are from community members who are expressing their concerns of data centers. Noise pollution is something not often discussed, but again, one of the bigger things as well. So just to put in some numbers, the CDC states that repeated exposures to workplace, so this is just workplace noise levels of 85 decibels or higher, is hazardous and is the decibel level that can cause hearing loss per the National Institute of Deafness and Other Communication Disorders. Unfortunately, diesel generators, the cooling systems, and the machinery in data centers are known to emit persistent noise that anecdotally can cause communities distress. And multiple frequencies are emitted from data centers, so it's difficult to measure directly what their decibel levels are, but they have been measured to be at 96 decibels. Diesel generators can get up to 105 decibels, and cooling towers can reach up to 70 decibels within 40 feet of data centers. Now, what about the general public? Continuous exposure to 50 decibels for just the general public have been linked to increased stress hormones, obesity, or blood pressures. And noise exposure can cause hearing impairment, again, sleep disturbances that can then beget to depression, anxiety, poor academic performances in children, or reduced quality of life. And so again, all these data centers are emitting way beyond that 50 decibel limit. That is very concerning for our communities. And then light pollution as well. So this is a cool map from the light pollution map. This is to find best stargazing areas, but this is to basically highlight it if you guys want to nerd out with it, the Bortle scale, which basically shows how much light pollution is in different regions. So all of the red and the whites basically means we can't see any stars. But this is a concern for many folks who live close to data centers. And even if you don't live close to one, given how prevalent light pollution is and how air pollution can actually enhance the brightness of this light pollution, we should all be concerned because this can disrupt our circadian rhythm, disturbing our sleep, which is linked to, again, increased stress, brain fog, dementia, obesity and hypertension, and mood disorders like depression. But I also want to bring it back that this all impacts our Earth's health as well. So we're disrupting the migratory processes of different birds or different fish, which then these changes in our ecosystems can influence the seed dispersal or soil nutrient cycling or reproductive success rates of species that then impact human society as well and destroy a mutualistic relationship between our planet and ourselves. And I do want to highlight, same with insects and plant processes, if they don't match up when they need to pollinate correctly because of light, we can actually face food scarcity because we're losing the diversity of food that we can have as well. I do want to end this really quickly by saying that, what can we do, right? Prevention is key, right? When we can tell our patients, oh, you can get blinds or shutters. if moving away is an option, I guess, but that's difficult, and that puts all the onus on them when this isn't their fault. And so some of the things we can do is, getting involved in any way, whether it's us encouraging folks, for example, and not to get too political, but like voting, for example, right? How can we encourage people to speak up, vote, and say, here are people who are worried about our health, our environment. How can we put that on the ballot, for example? Writing or speaking up at city council meetings, for example, writing to your reps. We are trusted voices in our communities, and we can help again elevate our communities' concerns by saying we are seeing these real life impacts in our hospitals, in our clinics, and we need to be concerned about this as well. All righty, thank you so much.
Thank you so much, Dr. Nishigaki. All right, we still have about 14 minutes left. I'd like to invite all of our speakers back. Natasha, if you don't mind turning your camera on, thank you so much. And we can open to Q&A. We've done our best to address some of these questions in the chat, and I also hope that we can get some of these answered out loud. So without further ado, our first question is from Chase Anderson. They ask, what are the best ways to communicate the health risks of data centers and the best ways to encourage them to use clean energy and minimize water consumption / maximize water conservation? Do one of you want to answer that? And then we can move on to more. We have quite a few questions.
Sure, I'm happy to hop in and kick off some response on this. I love this question, and I think we should always be thinking about how we can best communicate about these topics. I spend a lot of my time thinking about how we can communicate about these topics. I think that storytelling is really important. It helps make the connection between the data and the lived experience. So I think we should think about ways to tell our story. We should think about who are our trusted messengers. We all have a story in us, and I don't want to say that any of us should not tell our story. But I know I'm speaking amongst friends to a health audience that doctors and nurses are the most trusted professions, not the most trusted health professions, the most trusted professions overall. So utilizing trusted messengers to help get out the word, I think is of vital importance as well. I love to speak in maps. I live maps, I love maps. And so I think that also can help make a case of understanding the geography of where these may be located. So I think that also offers a resource to us as well. And I'm happy to hear from other panelists on their thoughts on communicating.
I think again, it's like what you said. A lot of it is storytelling. Like I said, I can go on for a while. I had to really shorten it, but I had to go on for. I can go on for a while. And someone mentioned the Q&A, so I'll bring it up too. There's the big picture effect, right? So even if we talk about data centers and the environmental impacts or the health impacts, it's like I mentioned, it's like a fourth, like you can go into like third, fourth, fifth order, right? Extreme weather events that can be tied to the air pollution, which data centers are contributing to as well. And so telling stories of these people who have gone through these environmental disasters, for example, or again, live close to these communities as trusted voices. The goal is to, again, elevate everything that we do see. And I think that's a huge important thing as well.
Thank you so much. I'm seeing a lot of questions in the chat about closed loop systems using less water. I don't want to go too far into this because it's quite technical and a bit in the weeds. But I did want to see if any of our panelists felt particularly strongly or wanted to share any quick remarks around that.
I think I just want to maybe very quickly, I do think that this is research that needs to be done. And one of the challenge about this research right now is that it's very hard to know which data center use what, right? Because the big developers, the hyperscaler developers do not disclose that information. So what we are doing on my side is trying with satellite images to understand which hyperscaler use closed loop, and then to see the degree to which the water consumption of this closed loop system it's much less. I want to point it out, though, that the research shows that 75% of the total water consumption of data center is at the energy level, so is at the level of the balancing authority and the power grid, and not at the data centers.
Fabulous. Thank you so much. Anybody else want to comment? Or we'll just move to the next question. All right. This one comes from Lilia Aurora. How can we push against the use of AI in general and hold AI companies accountable? Many people seem opposed to data centers, especially in their communities, but continue to use AI.
So maybe I can start. This is a very broad question, and I think it's hard to address very in a synthetic way. But I want to make a few points. I do think that I will not have a fight against data center to be is necessarily the same fight against AI. So I do think that we still don't know, but there is also a lot of potential positive impact of AI as a technology in healthcare, in climate. I myself using AI to potentially find better way to combat climate change. So I think the AI I feel like being against AI in its totality, I think it's premature because there is a lot of positive things of AI, at least from my viewpoint. I think data centers, I do think that this is where data research is so important because I do think that there is a lot of room of improvement for a more responsible way of building data center so then the potential negative impact on the community is minimized and the potential positive impact on the community where, for example, is creation of jobs and tax break and potential increasing healthcare should be maximized, right? So I think my quick answer is I hope that we are not mixing up being against the AI in its totality with being against the data center. And I do think that there is a lot of work that can be done for a more responsible building of data centers and then to have incentivized. But then I think the key point is to make the developer accountable and for a more responsible planning and deployment of hyperscaler data centers.
Thank you so much.
Oh,
And
okay.
if somebody else want to add something, go for it.
I agree. Unfortunately, like I said, the Pandora's box has been opened for the hyperscale AI data centers. I will say the first data center was built like in the 1940s or so. So we've had data centers for, these Zoom meetings that happen. It's just now they're coming more, they're being discussed more because of generative AI since like 2022 onwards. But I agree that if they have to be built, they should be sustainable, and that's where I think a lot of us can come in to say why they need to be, instead of just like full throttling, build and then figure out later, which I've heard some people say is the thing to do. Completely disagree with that, but
I just want to affirm what both speakers have said thus far, and just to add a little bit more that there are narratives that suggest that, well, if we want to use a certain large language platform, then we should be supporting these. I don't think that it is our individual use that drives this as much as we have large organizations and large entities. And having those organizations to have standards around their use, I think, can help. And certainly continuing to use all of the amazing ingenuity that we have to build these in ways that protect our health much better. I think that possibility is there.
Thank you so much. We don't have a ton of time, so I'm being a little selective in questions and so sorry for everybody if I haven't been able to address your question. Hopefully we'll get to it in one of the other sessions. And you're also welcome to follow up with me over email if you have any really pressing questions that you'd like me to relay to the speakers later on. But this one I think is really helpful. Is there such a thing as a safe and acceptable and beneficial data center?
Well, I think, yeah, that's another complicated question. I think what I've been learning, and again, I cannot claim to know everything about building a data center, is that it is nearly impossible to build an hyperscaler data center that rely 100% on renewable sources. And the reason is because they need constant electricity, and the renewable sources cannot provide the level and the constant. So having said so, I think as soon as you have some environmental impact, right, there is always going to be some impact. But it's also true that some of the hyperscaler and the big company are providing a community benefits agreement. And then the question is, are these community benefit agreement could potentially massively offset the minimum negative. So to me, the most responsible way would be to build a data center in a location and in a way such that all of this potential negative impact that we are talking about will not be zero, but will be minimized, but then to offset with significant community benefit agreement, building more hospitals, building more school, making sure that the noise pollution is not affecting the community. So then the long-term impact of having an hyperscale in your community will be overwhelming positive for that community and not negative. And I do fundamentally believe that's possible.
Great. One more question, and then I think we might wrap up soon. So actually, just wanted to flag for you, Dr. Dominici, there was a question in the chat is whether or not you could give some context on the YouTube video, just what the tool is and where it will be available. So I'm going to let you respond to that quickly.
Yes, sorry, I've been cut. I think that what we are doing is, so the tool is not available yet. We are working on it. And the goal of this tool is that you can both put in the tool any information about an existing data centers, and we can quantify all of the impact, or put in the tool a planned data center, and the tool will be a decision-making framework to how to mostly responsibly build this data center to minimize this impact. And that's ultimately the goal, is to have a decision-making framework for responsible development of data centers.
Great. Thank you so much. I'd like to give our speakers one quick minute each to close out, rather than going to another Q&A. If you have any closeout comments, feel free to share them now. And then I will be sharing one or two quick notes and we can wrap this up today. Thank you all.
Okay, do you want me to start? Okay. Well, clearly, I think this is a really, really important issue, I think, for public health, for medicine, and for AI and for energy. I do think that right now it's very contentious and it's based on data and science that is not rigorous. And so I'm personally committed to do the best possible science, so then we are not get locked in litigation, but we allow a responsible use of AI, so then AI can help us to make the world a better place. And at the same time, the community that need to bear the burden of data center will be better off.
So appreciate this conversation. So appreciate that we are centering health and equity and how we look at data centers. And I just encourage that we continue doing this. What I'll say is that location matters so much. And the Kapoor Foundation in California published a report on data centers across California. And what they found was that the single most important factor of how data centers affect people is where they're located. So I hope that we'll continue to ask the good questions about the locations of these to inform that as we go forward. Thank you.
Great.
Feel like I'm just going to be repeating what everyone says. But again, I think it's important that we do speak up on these matters, especially the health impacts. If there's a way we can get plugged in with our local communities or even our local workplaces as well to start holding our AI vendors accountable. If things are integrated into our workflow, I think that's also a great start to figure out who's using what do they do they promise transparency, sustainability, and so at least we can make a small we can hopefully start small and hold data centers accountable overall, but that's something I think we can also do as well.
Great. Thank you so much. I am going to very quickly share my screen. I want to make sure that everybody knows that we have, oh gosh, this is the wrong way to do it. Sorry. One more second. Okay. We will be having 3 more webinars in this session. I also want to thank each of our speakers for joining us today and sharing their expertise. It was so wonderful. We will be announcing those other speakers for these future panels coming up, so stay tuned. And if you haven't registered already or shared this with somebody else and you found it helpful, please do. Last but not least, I'd just like to say thank you to our partners and our speakers and everybody for coming here today. We have been recording the webinar today, and we will be sending around an email to everybody who's registered with that recording, as well as a PDF version of the slides that the presenter shared with you today, and some other resources that our organizations have been drumming up. So with that said, I want to thank you all again for joining us today. I hope you all have a wonderful day, especially to our speakers, and look forward to seeing you on the next webinar. All right. Thanks, everyone.